Hello, everyone. Good afternoon from Mexico City. It's gray and cold outside, raining. But here we are, one more week with everyone joining us here. Thank you for joining. And I'm going to stall a few minutes to see if more people join. In the meantime, let's just go through very quickly what we did on the last webinars. We went over those steps that are needed for a intended parent journey from A to Z. And those were, beginning your search with your agency, signing up, creating the embryos or shipping them. Afterwards, we have the surrogate matching process, then the embryo implantation, pregnancy tests, pregnancy itself, and then birth and exit process. Those webinars from previous weeks are available on YouTube. And if you're in contact with us, just ask your coordinator to share it with you. And today we are going to go over those steps, but from the egg donor perspective. You can imagine that she also has a very long journey for these donations that begins long before we think they do. And that's going to be today's subject, egg donor from screening to egg retrieval, and also some things that happen afterwards. So I'll get started. I see more people joining. That's great. I'll get started, and I'm going to share my screen with everybody here. Just give me a couple of seconds. Here we are. Ready. You should all be seeing my screen right now. And I'm presenting to you today's webinar, Egg Donors from Screening to Retrieval. And as I just said, we're going to go through a comprehensive look at the egg donation process and what you guys, intended parents, should know. Don't forget that at the end of the webinar, you'll have a chance to ask your questions. So don't forget to jot them down before you forget those questions that are going to pop in your minds as we move forward. You know me already. My name is Carlos. I've been working with Miracle for almost 6 years now. I'm parent of twins, and with the second journey currently ongoing, and let's see how it ends, hopefully with a very happy ending very soon. And as always, a disclaimer, all the information that I'm going to share with you guys is merely informative. Do not take anything for granted, and always consult with professionals from each specific field. Law, medical recommendations are also only recommendations from someone who is not an expert in medicine. So search for your medical advice and also for immigration advice when needed. Let's get started. And we're going to go through these steps, these points that we see on screen, why anyone should be using egg donors or not, the type of egg donors, how donors are screened, how to choose an egg donor, how medically prepared donors are, the egg retrieval process, fertilization and embryo development, and then you'll have a chance to ask your questions. So with no further ado, let's go with the first topic. Why some families use egg donors? Well, it seems obvious that if we go through a traditional fertilization process with intercourse, we have a man and a woman, but some people don't have the ability, ability to provide for donors themselves, for egg donors. Therefore, people need egg donors. And the reasons could be, for example, a couple in which a woman has a diminished ovarian reserve, that could be due to age, or premature ovarian insufficiency, meaning that the amount of available eggs in the ovaries is not enough, due to genetic conditions that could happen to prevent the woman from having eggs that are fertile. Also, it could be due to repeated IVF failures with the same eggs, and then they have to proceed and go with an egg donor. Due to advanced maternal age, that is also something quite common. It is not until later in their lives that some couples, some women, want to become mothers, and at that point, it's already too late, and they don't have enough ovarian reserve. And then, of course, for male same-sex couples, it's quite difficult to provide the eggs. And why not single fathers that want to fulfill their dreams of becoming parents and they need of an egg donor, right? As I always say, there is no single journey that is the same. There is no right or wrong path. Everybody's journey is unique. Types of egg donors. Pay attention because these might be important for many of you. Let's dive into the proven and not proven donors. It's very easy to understand. You might also hear we call them regular, not regular, VIP, not VIP. At the end of the day, it's all the same. A proven donor, a VIP donor is that whose eggs have already resulted in confirmed pregnancy and in most of the cases also in live births. And those that are not proven, it's completely the opposite. Even though they might have already underwent egg retrievals, their eggs have not yet resulted in confirmed pregnancies or live births. So this distinction is quite easy. Proven, confirmed pregnancies, non-proven, no pregnancies confirmed. Now, on top of proven and not proven, we have also frozen eggs or fresh eggs. Now, once we have the eggs retrieved, they can be either frozen or they can be fertilized. If we fertilize them, that means that we are using the eggs fresh. And if we freeze them, that means that we are going to use them in future fertilizations. And something very important that we'll deal in the next slide. Why should someone choose frozen eggs or why should someone wait for fresh eggs? I say wait because most of the times we have to wait until the egg donor is ready. And this is what we are going to review right now. So fresh eggs versus frozen eggs. Most intended parents that decide to use frozen eggs, they do it because they are already available. They are sitting there waiting for someone to choose that egg donor and they are ready to be fertilized. Whereas with fresh eggs, we have to wait until the egg donor is ready for ovarian-stimulation and also therefore the egg retrieval, which could be maybe a couple of weeks, a couple of months, or even much longer than that. Let's not forget that for an egg donor to be able to begin with the stimulation of the ovaries, she needs to have her menstrual cycle beginning. And we know that that happens every 28 days. But it might happen that your chosen egg donor just donated for somebody else. And in between donations, we have to wait at least 3 months. Therefore, if you choose one that is already donated and that donation has just happened, that means that we have to wait 3 months until the third menstrual cycle begins and she can begin another round of ovarian stimulation. Now, the number of eggs. If we go for a live retrieval with fresh eggs, we already know that all of the eggs that are going to be retrieved will be allocated for the intended parent. However, we have no certainty of how many eggs will be available for that specific retrieval. It could be 12, it could be 15, it could be 20, it could be 25. We don't know until those eggs are retrieved. But of course, all of these eggs, will be for the intended parent. Compared to frozen eggs, you do have the certainty once you choose frozen eggs, because if you're buying 15 eggs, that's the number of eggs that you're going to get, and all of those eggs will be mature. Now, the risks. I just said the word mature, and yes, when it comes to fertilization of eggs, some of them are mature, some of them could not be mature. Whenever we go with frozen eggs, all of those eggs are already mature. That means that they have reached a stage called metaphase 2 mature, right? And they are suitable for fertilization. However, if we go with fresh eggs, we might encounter that some of those eggs are not yet mature. They have not reached that metaphase 2 stage in which they can be fertilized. And those eggs will not be used for fertilization. It is true that whenever immature eggs are retrieved, those are left in the incubator, hoping that they do reach metaphase 2 in the next few hours. But it is known that on average, 10% of the retrieved eggs will not be mature. And that loss in numbers is part of the natural attrition that happens when fertilization occurs. And that is from the number of eggs retrieved until the number of embryos that we are going to obtain. On average, 30% of the mature eggs will reach the blastocyst stage, embryo stage, in which they can be implanted. Let's move forward and let's dive into who can become an egg donor. And one might think that any woman could become an egg donor, and the answer is yes, but there's always some criteria that have to be checked before accepting someone to become an egg donor. Generally, only women between 18 and 30 years old are accepted to become egg donors. There might be a few exceptions only on the higher part of the curve, 30, 31 years old, and we'll talk about that in a few moments. Then any candidate to become an egg donor has to be a healthy lady with no smoking or recreational drug use. They also must have a normal range BMI. That means height and weight must be proportional. They must be free from any STDs or STIs. They should have regular menstrual cycles. They should not have any serious psychological disorders. They have to be willing to undergo a medical and a psychological evaluation, and they must be ready to proceed with egg donation if chosen. Let's talk about age, because I just said that sometimes we do allow someone to be out of that range, especially if it's on the higher part, 30, 31 years old. And the age is based on egg quality, the expected ovarian reserve, the safety considerations, and also the treatment outcomes. And to explain that very easily, the younger a woman is, the higher the expected reserve of eggs that she will have. Also, we expect to retrieve more eggs and more mature eggs from a younger egg donor compared to an older egg donor. And as I just said, whenever an egg donor is chosen, she's 30, 31 years old. She will also go, of course, all of the screening. And depending on the results of that screening, she might be accepted to become an egg donor. Of course, only if the doctors have approved them, therefore she has received a medical approval. And sometimes when that happens, we do see these ladies being beyond 30 years old to produce more eggs than we would expect. And I'm talking about, for example, a lady who is turning 32, having a high reserve of eggs in the ovaries and providing probably 15, 18 eggs. That's not unusual. That's not the common result either. But again, as long as the egg donor has passed all of the screenings, age, let's say, is a bit flexible. Donor testing. This is a bit complex and there's a lot of words here. So if you have questions, please remember to ask them afterwards. Every single egg donor, before she becomes approved and she is on our website, has to undergo a complete blood test count and hemoglobin to make sure that there is nothing that could prevent her from becoming an egg donor or health problems such as anemia. Also, we check for the blood type and Rh factor. It might sound strange what you're reading on screen, but if there was an emergency after the egg retrieval and the egg donor required a blood transfusion, we have to know the blood type and Rh factor to make sure that we are providing the correct blood type. Then HIV test, Hep B, syphilis, hepatitis C, chlamydia, herpes, and cytomegalovirus. Those screenings happen on all of the egg donors, and they have to be clean before proceeding with egg donation. Continue with some more tests, and here is the part that is more technical. There is 3 different hormones that are four actually that are measured: FSH, follicle stimulant hormone, LH, luteinizing hormone, AMH, and Mullerian hormone, and then estradiol. Those four combined serve the purpose of understanding how high or high-low is the expectation for an egg donor to produce more or less eggs. Then we have also thyroid test that if wrong, I mean, if the results are not okay, the thyroid could also impact the egg quality and the egg numbers, prolactin, and then very important, egg donors have to undergo a pelvic ultrasound and antral follicle count. We'll see more of that in a few slides. Now, the overall health, specifically the healthy BMI. The BMI helps us understand whether we should expect a good or a not so good cycle. And whenever an egg donor is not within the expected BMI, they are requested to adjust, to maybe lose some weight, and then come back. Why is that important? Because we want egg donors to be healthy in order to provide the best possible results. The medical history. 2 times throughout the whole screening process, egg donors are requested to provide a detailed medical history, hoping we can identify any genetic abnormalities or diseases. Okay, those 2 times are at the beginning of the screening and then right when they are at the doctor's office. The first interview happens with Miracle staff members, and the second happens at the clinic with the doctors. And any candidate to become an egg donor needs to answer questions regarding medical conditions, a history of inherited diseases in their families, and reproductive health history. That means whether they have been pregnant or they have had any miscarriages or anything that is relevant to the actual process of egg donation. Physical examination. This is the most important part of the process because even though we have tested for hormones, for blood works and everything, if those hormones are not supported by a visual result, meaning that we are seeing those ovaries with plenty of follicles, they won't be accepted to become egg donors. There is a general physical checkup, then there is a pelvic exam, and then this is the important part, a transvaginal ultrasound. The image you see on screen is an ovary, and all of those black dots that you see there are follicles that contain eggs. The black part means is the liquid part of the follicles, and inside we have the eggs. Now, what do we want to see during that ultrasound? Well, we want to see the size and the growth rate of those follicles. We also need to measure the thickness of the endometrial lining. We also need to see that the timing of ovulation is right. And we also need to check for any abnormalities in the ovaries or the uterus. Now, the timing of ovulation, sorry. How do we know at what point of the ovulation timing is that, that egg donor? Well, follicles will be bigger the farther into the menstrual cycle we are. And that's why these transvaginal ultrasounds are typically conducted on the first days of the menstrual cycle. After they have passed the physical examination and they have done the hormone testing, they might already become egg donors. But I want to stop for a few seconds on this specific AMH hormone, anti-Mullerian hormone. Many intended parents request for the hormone levels, specifically AMH levels, because they think that that will determine how high the reserve of eggs will be in their eggs. And sometimes, yes, that's a good indicator, but it's not the only indicator that we have to understand the actual ovarian reserve of an egg donor. There's these ranges that we have here on screen. A AMH beyond 6 means that the ovarian reserve is very, very high. An AMH between 3 and 6, it's a high reserve of eggs. And anything between 1 and 2.9 is considered normal. Now, again, this should not be the only factor used for deciding whether to go with one egg donor or another. Because I will say it again, it is not the only factor that is being considered for an egg donor to be approved or not. Psychological assessment. It is extremely important that egg donors understand what the process entails before, during, and after. That is why they are screened by a professional, a third party. On mental health, we look for anxiety, depression, OCD, bipolar disorders, and other emotional or psychological concerns that could arise. We also check the family history with the egg donors, meaning that we have to understand if there is any personal and family history of mental health conditions, or there is a potential hereditary or environmental risk factor for that specific egg donor. And then we also check the personal stability of that egg donor, employment and financial resources, stable living arrangement, friendships and romantic relationships, support from family and friends, and ability to manage stress and make informed decisions. All of that is extremely important because, once again, we're dealing with humans, and some of them, there's conditions that could have an impact later on during the process. And as I just mentioned, we need to understand how they are before the process, during, and after the process. Let's continue with the lifestyle assessment. That's basically making sure that there are no habits that could have an impact on the overall result of the process. No smoking or nicotine, no drug use, alcohol use, and also if there is any supplement or medication that is being taken that could have an impact on the actual results of the egg donation process. Because it is true that we already know that smoking, drugs, and alcohol have an impact on the actual results. But there are also some nutritional supplements and medications that do have an impact on the actual quality of the eggs or even the number of eggs that will be available. Let's move on to the next section, which will be choosing an egg donor. Now, right on the screen, you see an image of the actual website where you can see our egg donor database. And what will you find during your search of egg donors? What information will be available? Well, it is true the information that you'll be seeing is limited, but that will include age, height, and weight, also the ethnicity of that specific egg donor, the education, occupation, blood types. You will be seeing also real pictures of the egg donor, and you will be able to request childhood pictures. If they are available, we are happy to provide them. And you will be also seeing a summary of their personal interests and their family history. Now, right here, you see an actual profile of an egg donor. In this case, we have PCDMX1679, and that is how the profile looks. Now, each surrogacy journey for you guys will be different, and each of you will be looking for different features on that specific egg donors. And you might want to do that based on the medical history of the egg donor or the family history, the genetics. Many of you, including myself, we chose an egg donor based on how she looks and because she looks like someone from our family, or we actually look for some features of that egg donor that remind us of someone in our families. Some might also take into consideration whether this egg donor that they like has donated before or not, and whether there's results from previous donations. And many also consider availability of the egg donor to be a factor in their decisions, right? Availability is important because once you request your coordinator to provide the availability of those egg donors that you like, you might find out that your preferred egg donor, your number one, is available in 6 months, or your number two is available in 3 weeks. And if you don't want to wait, you might go straight to your second choice rather than your first one, because the first one is not available at that specific moment that you want to begin your journey. But make sure that you ask your the egg donor's real-time availability to your coordinators, making sure you have real-time availability, because it's also important to understand that availability of egg donors changes overnight, literally, because there's dozens of intended parents searching for their preferred egg donor. And the way it works is first comes, first served. If you reserve an egg donor and you pay for her, she's yours. And anyone who asked about her will have to be the next in line for that specific egg donor. Now, the medical process for the egg donor, it's a thorough process, and it begins with the cycle synchronization. What it means basically is that we need to have control over the menstrual cycle and have certainty over the dates in which we expect the egg donor to begin with the menstrual cycle. And for that, we might use birth control pills. We might also just wait for the natural cycle to begin, but that gives us less certainty. And we prefer always to use birth control pills because that gives us more accurate dates. And as I was saying, this allows the doctors to control the timing and synchronize the follicle growth, as well as reducing the interference of any ovarian cysts that might be present in an egg donor, and also helps with the monitoring and scheduling of the appointments and later on the egg retrieval. The birth pills that are provided for egg donors in order to control or to have control over their cycles, it's a combination of estrogens and progestin that temporarily suppress the natural FSH, follicle stimulant hormone, and LH, luteinizing hormone, for that cycle. Meaning that if we suppress those hormones to enter in action, we will be able to begin the process as soon as that egg donor starts with the bleeding of the menstrual cycle. It is not uncommon that egg donors use other contraceptive methods, and each one of them will be assessed individually, and the timeframes might and most likely will vary, because sometimes other contraceptive methods need a prolonged or a longer intake of birth control pills to make sure that we can control the actual cycle. Now, once we begin with the actual stimulation of each egg donor, the medication is provided, as you can see in the picture here, via self-administered injections. Those injections contain the medication that will tell the egg donor's body how it has to work towards a better result in the egg retrieval. In other words, the medication is telling the egg donor's body that she has to stimulate all of the available follicles for that cycle instead of only one or two dominant follicles that would be stimulated naturally in a natural cycle. Now, during that process of self-administered injections, there are several appointments happening. And typically, once the egg donor begins with the stimulation, it's after 5 days that she goes back to the clinic to be checked for follicle growth and number of follicles. Then she goes back every other day to still continue to control and monitor the growth of follicles. And she will also undergo blood tests. And typically towards day 9, day 10, they will take what is called the trigger injection, which is one last shot of medication that will tell the ovaries to basically get ready all of the eggs, that those will be retrieved in approximately 36 hours. This is what I was just explaining. between the moment she begins with the stimulation until the egg retrieval. Monitoring visits happen on the 5th day and then every other day. Ultrasounds to monitor the growth of the follicles and also to count the follicles that are growing. And blood tests also will be happening to make sure that the ovaries are receiving the amount of hormones and medication that they need. And in some cases, depending on how this evolution of the cycle goes, the medication will be adjusted in order to maximize the results of the egg donation. This is a very visual infography of how the stimulation cycle works. On day 1, menstruation begins. Day 2, day 3, that's when the stimulation begins with the self-administered injections. Then on the next days, there's the monitoring visits with ultrasounds and blood works. And around day 6, day 10, there is another hormone added, it's called antagonist. And then after approximately 9-10 days, it could be more, but typically it's around 9-10-11 days. The egg donor is provided with a trigger shot, the trigger injection, which tells us that the egg retrieval will be happening 36 hours later. Now, I will never be tired of saying this. Every journey is different for intended parents, and every journey is also different for each egg donor, meaning that some egg donors will require 9-10 days of stimulation, others might require 10-12 days of stimulation. That is why it's extremely important that egg donors go to these monitoring visits to understand how the follicles are growing and when they will be ready for the trigger shot and then the egg retrieval. The process is a medical process, and of course it can have side effects, which most women will know because they are similar to a normal menstrual cycle. However, given that we are providing medication to stimulate not only 1 or 2 follicles, but all of the follicles available, the feelings, the symptoms will be probably much more and more intense than in a normal menstrual cycle. That could include bloating, mood swings, some bruising in the area where the self-administered injections are being administered. Then fatigue and headaches are also common side effects of the egg donation that could happen during and after the actual egg retrieval. Each egg donor, again, is monitored throughout the whole process to make sure that none of these symptoms become a problem, and especially after the actual egg retrieval. It is extremely important to monitor what's going on in her body because there is always a risk of ovarian hyperstimulation syndrome. In plain words, that means that an egg donor could have been provided with too much medication that could result in extreme side effects that again include bloating, fatigue, headaches, bruising, nausea, and it is very important to react if that hyperstimulation syndrome is detected. Thankfully, it's something quite uncommon due to the actual good work that clinics around the world do to administer the medication in the exact doses that each egg donor needs. Let's move on with the actual egg retrieval. Now, the egg retrieval, it is a small surgery, and therefore, to prevent the egg donor from feeling uncomfortable, she will receive sedation, and the actual procedure of retrieving the eggs will be happening via a vaginal ultrasound in which a cannula will be inserted, reaching the ovaries, and there is a small hook, let's say, that is going to retrieve every follicle available in that ovary. And that procedure typically lasts between 20 and 30 minutes. It could be a bit longer. It all depends on the amount of eggs / follicles that are available for that egg retrieval. And it is very common to feel mild cramping, fatigue, some spotting, bloating right after the procedure. However, it is also very common that egg donors are back home only a few hours after the actual egg retrieval, and they should be able to resume their normal activities within 1 or 2 days. And also important to mind that an egg donor that just underwent an egg retrieval cannot be alone, meaning that they will be the clinic accompanied by at least our coordinators, but most likely also a friend of theirs or a family member that will be with them. Remember to write your questions and ask them afterwards. Let's go on what happens after the eggs are retrieved. Well, it's very easy because the eggs are retrieved and then they can be frozen for future fertilization, or they can be fertilized to create the embryos, with, of course, the intention of implanting them afterwards into a surrogate. If you freeze them, they can be frozen for many years or just a few months, but then they'll have to be thawed for the actual embryo creation process. And this is all I have for you today, guys. So it's time for your questions and answers. So please start your rounds of questions and answers, and I'll be answering them as I receive them. I just need to understand how this works because there's a lot of things here. Give me a second. Perfect. I don't see any questions yet here. My colleague Eduardo is helping me here with the technical part. Eduardo, I don't know if you can see something I cannot. I see only a few people that have remaining in the webinar, but that's still great. If you have questions, please feel free to ask. And in the meantime, I just wanted to share with you that there will be more webinars coming in the next weeks. All the information is available on our website, www.miraclesurrogacy.com/events. That's where all of the webinars are listed. And the next topics will be the surrogate's journey, just as we have seen the egg donor journey. We will also see the surrogate's journey. Then we will have another one for budgeting your journey and payment plans and payment structures. And then there will be another one in which we will deal with the exit process and everything around it. Now, if we don't have any questions, I don't see any popping in. That means that everything was clear. But remember that if you're in contact with one of our coordinators, you can ask him or her your questions and you will get the answers. And also, I wanted to remind you that you will be receiving an email after this webinar with the presentation that I just shared with you. And also, I will include a link with these webinars on YouTube. Thank you. Thank you very much, everyone, for joining today. Thank you to my colleague, Eduardo, and thank you for the team that is not present today that helped me prepare the presentation with lots of information that I am not currently using on a daily basis about egg donors, but they were so kind to provide, and that's the egg donor department.